Wadinger is the director for the Center for Psychodynamic Therapy here at MGH. He's a clinical professor of psychiatry at Harvard Medical School. He's also director of the Harvard Study of Adult Development, which has studied the lives of groups of men for over 75 years. Dr. Wadinger is now beginning a study of more than 2,000 children of these men to estimate how childhood experience affects midlife health and well-being. For more information about this research, Dr. Wadinger has a TED Talk that's available at www.robertwadinger.com. Dr. Wadinger received his bachelor's degree from Harvard and his medical degree as well from Harvard Medical School. He's the author of numerous scientific papers as well as 2 books, Psychiatry for Medical Students and Psychiatry for Borderline Patients, Case Studies. He's a practicing psychiatrist and psychoanalyst. He teaches Harvard medical students as well as trainees in psychiatry here at MGH. And he's on the faculty of the Boston Psychoanalytic Institute. And if that wasn't enough, he's also a Zen priest. So without further ado, I will hand it off to Dr. Wadinger, who will talk on individual therapy, a different kind of relationship that promotes healing. Thank you.
Thank you, Dr. Schulman. And oh, good. Good morning. I have a 12-year-old Prius that is usually very reliable, and this morning it decided not to be reliable on the Mass Pike. So my apologies for coming in at the last minute. But this morning I get to talk about something that I really love and have been practicing for, gosh, almost 40 years, which is individual psychodynamic psychotherapy. And I thought I would first sort of address the question of what brings people to talk therapy. Oh, yes, no financial relationships to disclose? Okay, so what brings people to talk therapy? Because in fact, most people cope very effectively most of the time. We cope with all kinds of challenges in our lives and many, many hardships. So, in fact, most people don't come asking for psychotherapy most of the time. So what does bring people to that point where they feel that they want that special kind of help? And really, it comes down to patterns that seem repetitive, that people haven't found their own ways to undo. Sometimes they're incapacitating symptoms. 2 of the most common are symptoms of anxiety and symptoms of depression, among the most common things that we as human beings have to cope with in our lives. There are also addictions. Of course, there are addictions to substances, alcohol, and as we know in the news, opiates, and many other psychoactive substances, but also addiction to gambling, sexual addictions, addictions to using the internet. People who simply cannot stop being online and their lives are falling apart as a result. And then there are behaviors that we know are self-defeating, but we can't stop ourselves. So people who know that they end up sabotaging relationships, but they don't know why. Or people who end up getting themselves fired from jobs and knowing that they keep repeating the same scenarios, but again, they haven't found a way to make that pattern stop. And sometimes people come for psychotherapy because they're just stuck in their lives. They're just unable to take some big step that they want to take. So it might be the step of moving away from home, moving out of the house, the step of going to college, the step of getting married, the step of letting the children grow up and move away, That some people get so stuck that they can't move on. They know they're stuck, and they've tried all the different things they can think of. So many of the things that bother us are emotional, that you may know that when people go to primary care doctors and they study this, over half of all the complaints that we bring to our primary care physicians are emotionally based complaints. Many of them are helped by psychotherapy. So, how do talk therapies help? Well, they find when they study it that all good psychotherapists do certain things in common. And this is going to be true of all the different kinds of therapy you hear about today. First of all good therapists find ways to help mobilize their patients' expectations that help is really possible. Therapists also convey the belief that the patient can make changes. And this is no small contribution when people often come because they're hopeless. Therapists offer ways of making sense of bewildering problems. One of the things that can be so helpful if you've ever, I know we've all had the experience of someone making sense of something that didn't make sense to us, saying, oh yes, you're experiencing this, this, and this, and here's what it is. And there's just a relief in that organizing of what the problem is. And this better understanding often helps enhance a sense of control. The other thing that a therapist often does is just models a more adaptive attitude toward the problem. Models the attitude that problems can be faced squarely rather than avoided. That thoughts and feelings that seem unbearable can actually be talked about and are bearable. And what happens often is the person in therapy comes to adopt the therapist's attitude of non-anxious, facing toward the problem. And of course, what therapy can do is create a safe space to take risks. Well, what kind of risks? Of course, the risk of talking about forbidden thoughts and feelings in the first place. Often a big risk when we've told ourselves or people have told us, not okay to talk about these things, not okay to let yourself even think or feel these things. And suddenly you have a place where it's safe to do that. These are often, for many people, angry feelings or sexual feelings. What makes therapy a safer place than many other places? Well, first of all, there are clear boundaries to therapy. We establish exactly what's going to go on, what the therapist and the patient can expect. And one of the things that's most helpful is that the therapy relationship is limited, that it's not a friendship, it's not a social relationship. So nobody's going to ask you as the patient for any special favors. You know exactly what you need to do. You don't need to do anything else. You don't need to please your therapist. You just get to be who you are and show up exactly as you are. And the other thing that therapy does is it expands our views of what's possible, what our options are, and our views of ourselves. Often people come with very set ideas about who they are and what's going to happen in their lives. For example, a patient who's gay and whose family has told her that she can't ever be gay, it's not acceptable, can't even begin to believe that she could have a happy life as a gay person. All of that gets to be explored. So, as you know, psychodynamic therapy is not the only kind of talk therapy. We're going to talk about psychodynamic work today, but the many different approaches include behavior therapy, cognitive behavior therapy, various mindfulness approaches. And there are different modalities, and you're going to hear about that today. So I'm going to talk to you about individual therapy, one-on-one, but you're going to hear about group therapy and couples therapy, and later on in the afternoon, combining therapy with medication, which we do quite a lot. So, what is this thing we call psychodynamic therapy? And the themes I'm going to talk about are going to run through the other talks today. So, there are certain basic premises in psychodynamic therapy. One is that what's going on right now in our lives is shaped by our past experience. That all the attitudes we have, the styles of reacting to the world, are to some extent carryovers from our past experiences. And of course, how could they not be? How could we not come to expect certain things in our interactions? When you came here today, you expected that most of us were going to sit quietly and one or a few people were going to talk, but we weren't going to all talk at once. We weren't going to get up and dance, although at some point you might want to do that. But basically, we have to have certain expectations of how interactions are going to go. That's not a problem. We learn from our past experience, and thank goodness that we do. Or everything would be up for grabs all the time. But sometimes that gets us into trouble, and I'll explain more about that in a few minutes. The other thing that psychodynamic therapy recognizes is that some of what motivates us we're not even aware of. Some things are driving us that we don't have much inkling of, but that we can learn about, and it can be very empowering to learn about these. So, for example, we can be at war with ourselves. We can be in the midst of psychological conflict. We're always managing conflicts in our lives. There are always conflicts, for example, between a wish to get ahead, but a fear of hurting other people. And so we feel both at once. Or the wish to grow up, but also the wish to remain a child. Very common in adolescents, but sometimes common in people like me in their 60s too. And sometimes these conflicts aren't always in our awareness, these tugs of war within ourselves, that we may actually banish them from our awareness because we don't know what to do about them. Let me give you an example. Let's say a small boy has a physically abusive father. And the boy is really angry about this, but he needs his father's care and protection. You only have one father in the world. So the little boy may banish his angry feelings, but those angry feelings may come up in other ways. So he might start having physical symptoms. He might start having stomach aches and not be able to go to school. Or he might start saying, well, okay, I'm going to be like my dad, and he might start bullying other kids at school. Or he might start being afraid of other things instead of his father. We call this displacing your fears. He might become afraid of monsters and be unable to sleep by himself. So, besides conflicts, there are things we call deficits, basically basic abilities that we haven't quite developed. Problems with impulse control, problems being able to distinguish our own feelings from other people's feelings, problems anticipating what's going to happen if I do certain things. Sometimes we do things that other people can see really clearly and we can't see. I bet you've had that experience seeing other people and saying, why don't they see what they do? Of course, but we're sometimes the last person to see what's going on with us. And yet, it's getting in the way, and therapy can help. So how do we learn what's causing these problems? Well, the therapist takes a good history of what's going on in the patient's current life and patient's relationships. And then the therapist, in the course of psychotherapy, uses the therapy sessions as an actual laboratory to see how the patient operates. So how does this work? This is actually one of the most interesting things about psychodynamic therapy, and it's different from other kinds of therapy. So essentially, and we call this old wine in new bottles, transferring expectations from previous relationships to what's going on right here with the therapist. It's called transference. And transference can get people into big trouble. So, for example, that boy who had an abusive father, let's say he grows up and he's getting into trouble in lots of places in his life. He keeps getting fired from jobs because he sees every boss as a bully who he has to protect himself from. So what happens if he gets into a psychodynamic psychotherapy? Well, at first, he may be pretty happy with his therapist, but he might subtly begin to feel that his therapist is kind of bullying him, is kind of pushing him around. And then he might start resisting by coming late to therapy sessions. Turns out it was a helpful way as a little kid to be angry without getting directly angry at his father, essentially to go on strike by being late, maybe by not paying his bill. It's called passive aggression in our language. But of course, as an adult, it doesn't work very well. It gets you into trouble in lots of areas of your life. So he starts coming late to therapy sessions. And the therapist begins to pay attention and begins to say, hey, what's going on with this lateness? Also, the therapist can use herself or himself as a diagnostic instrument. So I often have patients who come late, and as experienced as I am as a therapist, sometimes it makes me angry. Because I think, well, gee, I'm on time, and I've rushed to get here to be on time, and this person just doesn't seem to care. And so those angry feelings suddenly become a window on what's going on. So the therapist may begin to say, hey, I'm feeling angry. Maybe this patient, without meaning to, is trying to make me angry because maybe my patient's angry. The other thing I could do with this patient, the man who had the abusive father, is to ask him to tell me a little bit about how he feels when he's late or how he feels when he thinks about coming to our meetings. And he might begin to have trains of thought that lead to being late everywhere and then remind him of all of his father's strict rules and how he used to get so angry he would try to break the rules. And so we follow the patient's trains of thought, and in that way we get clues to what some of the problems are. All of this because the patient is demonstrating right in the therapy sessions what he or she does in their life outside. So I'm going to give you an example of how this might work, a case example. Of a patient who was in therapy with me for several years. Let me see, I need to do the next slide. So I'll call the patient Ms. R. And by the way, these details are disguised. Because one of the things that we do is we never talk about an individual in a way that anyone could recognize when we talk about it in public, because one of the important things about the therapy relationship is that it's absolutely confidential. Even the fact that someone has ever been my patient is confidential. So when I tell you about this, it's in a way that you would never be able to recognize a real person in the world, but it is a real case. So Ms. R, when she came to see me, was 35 years old. She was single, an attorney, and she was referred by her gynecologist at Mass General. And the complaint, the reason why she came to her gynecologist and then she came to me a little puzzled was, I want to be rid of my uterus, which is quite an unusual complaint to come to a psychotherapist with. But her gynecologist wisely knew that this was a problem because she did not have reason to have a hysterectomy. She did tell me that she was unhappy, that she had a lot of pain and bleeding around her menstrual cycle, and that's what made her want to have a hysterectomy. But that she was also unhappy at work. In her law firm, she was an outcast. She felt like people didn't like her. In her romantic relationships, she couldn't stay with a partner for more than about 6 months. Initially, it would go well, but then she and her boyfriend would start to have fights, and they would break up. And this happened several times. And she was at a point now where she was afraid that she was never going to find anyone she would be happy with. So here we had 3 big areas in which she was having terrible troubles in her life. Physically, she had physical symptoms for which her doctor, her medical doctor, thought she should not have the treatment that she wanted. She was having trouble in her love life, and she was having trouble in her work life. All 3 indications that she needed help. So I asked her about her background, and she told me what it was like growing up. She said her parents divorced when she was an infant, that she never knew her father, and her mother quickly had to put her into foster care because mother was poor and could not support her. But at age 6, her mother had stabilized her own life, had a good job, was able to support a child, so she brought her out of foster care, brought her back. But mother had her own difficulties, had a very hard life, and mother was verbally abusive. Mother would fly into rages with Miss R and say to her as a tiny girl, you should never have been born, I should never have had you. Called Miss R crazy and stupid. The patient withdrew into lots and lots of fantasy. So as a little girl, she'd make up imaginary friends because she felt that her mother didn't love her and she needed friends. She excelled in school. In fact, she was anything but stupid. She was incredibly bright. And she found a way to work her own way through college and then ultimately through law school. So she was quite an accomplished person after a very difficult background. So she and I met weekly in psychodynamic therapy. And initially she liked me. She was eager to tell me about her life and her past. But she began to have many conflicts with our time. Many things got in the way, many meetings. And when I would ask her about it, which was my job, she said it had no meaning, and why was I bothering about this? It was trivial. She was late to lots of meetings. But she did tell me she broke a lot of dates with boyfriends, and that actually she did notice that she broke dates with boyfriends when she felt bad about herself. And she came late to our sessions on days when she felt particularly bad about herself. So I started to be curious about her withdrawal from our sessions and noticed, I understood that when she felt bad, she might not feel like she could just show up and be who she was. And she admitted that she thought I was going to find her lazy and stupid, that she didn't have anything interesting to say, that she wasn't a good patient. And we talked about this, and I reminded her that this was sort of what her mother talked about, that this was her mother's view of her. And we talked about how Miss R had actually taken on her mother's view of who she was. This terrible self-criticism that Miss R had developed. And how everywhere in her life she assumed that other people shared these criticisms. At work, her boyfriends, and she assumed I shared these criticisms too. And at that point, her relationship with me started to shift. She started, she had liked me a lot in the beginning, and then she started to notice a lot of shortcomings in me. She decided that actually I wasn't very bright, that I kind of said boring textbook things. And once she actually said to me, okay, Dr. Waldinger, what textbook did you get that one out of? And she decided I wore kind of dumpy clothes. And she was a very tall person, and she started calling me vertically challenged because I was short. She had read a few of the papers that I'd written, and she said, yeah, my writing, it promised a lot, but I didn't really deliver the goods as a psychotherapist. And, okay, I've done this work for a long time, but I started to feel bad in the sessions. It actually began to bother me. I felt kind of like a scolded child. I felt like I was starting to feel the way she must have felt as a scolded child. And at one point, I said this to her. She was really on my case, and I said to her, I think I know what it might have felt like for you to be the brunt of your mother's anger. She was quite shocked when I said this, and first she burst into tears, and then she talked about how much she really believed her mother's criticism, and that she knew that she could be like her mother. She could be, in her words, a bitch. And she realized that she was really scared of how mean she could be to people, and that she was constantly trying to rein herself in. And then she finally talked about the fact that she never wanted to have a child because she was afraid that she would do to a child what was done to her. And that was why she wanted to make sure she would never have children, and that's why she went to her doctor saying she wanted to be rid of her uterus. Well, we worked on this for 2 solid years. Once a week, every week. What changed? Well, eventually her view of me actually got a little more balanced. She realized that I wasn't wonderful the way she thought I was in the beginning, but I also wasn't worthless either. That I was just a guy who sometimes could be helpful and sometimes wasn't that helpful. But that I was also someone who really wasn't critical of her and didn't share that view of her as lazy and stupid. And her view of herself began to change, that she was much less self-critical, and that when she started to withdraw from other people, she began to be more aware of the connection that, oh, wait, I'm feeling bad about myself right now, and that's why I'm trying to hide. She also started to reflect more on her mother. First, she started to be more and more angry at her mother, but she also began to be aware of mother's limits, how terrible it was to be a poor, single woman with a child. And she began to have more empathy for her mother's struggles in her life. She had a boyfriend with whom her relationship started to improve, that she realized that the boyfriend wasn't the dreamboat she initially thought he was, but he also wasn't a jerk. He was actually kind of decent and very nice to her. And her relationships at work started to improve. She got friendlier, and in response, other people got friendly to her. Her physical symptoms subsided somewhat. Her periods were still difficult, but much less difficult than before. And for the first time, she began to think that she might actually want to have a family of her own. So, just to conclude, what can talk therapy do? Well, it can relieve symptoms, including physical symptoms as well as emotional symptoms. It can increase self-esteem. It can make us feel better about ourselves when we have been stuck, feeling lost and inadequate. And it can help us function much better in relationships. You're going to hear about couples therapy that explicitly does that, but individual therapy can too. It can help us be better partners, better parents, function better at school and at work. And actually what we've learned is that psychodynamic therapy can change brain function. There are some interesting new studies now showing that the brain works differently when we put ourselves in MRI scanners before and after psychotherapy. So all of this is to say that this is a very powerful form of treatment, and one that has for now over a century been used quite effectively for a whole variety of problems that for which people seek help. So with that, I'm going to stop, and I think we have some questions. Do we have time for a question and answer? Okay, great. Thank you.